improving performance in certain situations. And sporulin and histostat were identical in this, and another candidate that we were testing was not good. We thought we had one that might be better. Interestingly, this flock was salmonella positive. So we said, okay, at day 23, we're going to take a population of these animals from every pen and culture them for salmonella. We look at the percent salmonella positives. The control birds were 50%, which pretty much reflects what's going on in that house, and realize that salmonella dust, feces, and so forth is coming freely between those pens. And histostat produced a numerical drop. That's actually been shown in the literature. That's a real phenomenon with these organic arsenicals and the gram-negative enteric pathogens. But sporulin produced a tremendous drop in colonization, even in the commercial facility with all the challenges that are coming in from the 99.9% of the birds that are not treated with anything. Looking at the numbers of salmonella, we saw a tremendous drop in salmonella as well. This is the first field evaluation that we did with a commercial integrator, and we were looking at daily mortality in this particular graph, and what we were interested in is this spike right here, which was associated with necrotic enteritis in the control birds versus the sporulin-treated birds. And the cumulative mortality is here, and that spike right there is what we saw in the controls versus the sporulin-treated birds. Very, very impressive in this case. The adjusted feed conversion was numerically improved by sporulin treatment, and the weight was improved. But here's where it gets interesting. The age, where they were processing to meet their targets, the sporulin-treated groups were actually processed 2 days earlier. They were heavier, but they were processed 2 days earlier. So how do you compare? You look at average daily gain. And we saw an 8.7% increase in average daily gain in the treated versus the control birds in this field study. This is an independent research trial that was done last year by a independent company that does contract research. And they compared bacitracin at 50 grams per ton, sporulin at 250 grams per metric ton, or a half pound per short ton. And bacitracin was added only in the starter and grower feeds as per their regular program. 20 birds per pen, 10 replicates per treatment. Good sized trial. And what we found was that the day of hatch body weights, okay, just by random chance, the controls were actually heavier than the bacitracin or the sporulin-treated groups, okay? Well, at least we didn't give them an advantage, our treated groups an advantage. But by day 29, we saw basically no difference in the bacitracin and the control, but we saw an increase in day 29 and day 46 body weights with the sporulin-treated group. Feed conversion at day 46 was also tremendously improved by the sporulin-treated group. Moving to a rather large field trial that was conducted in Asia last year with the PVG program. We look at the age was the same, okay, and the livability, we're looking at the control here versus sporulin here, numerically improved livability. Body weight at processing was numerically not quite statistically significant. Oh, it was significant, sorry. Significantly improved. And average daily gain, again, was hugely and significantly increased. Very similar to what we saw in the US studies in the field. The adjusted feed conversion was 17 points in this very large study, and the production factor that was used by the company was markedly improved. We have spent literally many years working to develop these cultures and these products. Clinical field trials with many companies in several countries, including the United States, South America, and Asia, have already been completed. There's a few that are still ongoing. We've got data that says under real-world conditions that the efficacy of these products is very similar to some of the star antimicrobial programs that have been used traditionally. That's a very exciting development for our laboratory, and I think for Pacific Vet Group. We have seen remarkable improvements in feed conversion, uniformity, and average daily gain, and exclusion of pathogens. We're looking now at developing the third generation of antibiotic alternatives, and looking for ways to even more significantly improve performance with application of non-antibiotic alternatives. And there's a lot of evidence that inflammation, inappropriate inflammation, and reducing that inappropriate inflammation is the key. So a lot of the work that's ongoing in our laboratory right now is focused on developing some really unique models for measuring gut-specific enteric inflammation that is likely exceedingly correlated with performance as a model for development. And I think I've got a little bit of time for questions. Thank you very much for your attention. Questions? Yes, sir.
Yes, Professor. As far as I know, Bacillus subtilis and Bacillus lethal has been widely used for animal health. So in your opinion, is there any new Bacillus to be applied in this field?
That's a very good question. Okay. When we say Bacillus subtilis, it's like saying, think of a species of dog, okay? A Chihuahua is not a German Shepherd, right? It's not a Great Dane. They're very different organisms. It's a species, yes, but individual isolates are very, very different. We found Bacillus subtilis isolates that actually reduced performance. We found Bacillus subtilis isolates that had no effect. We find Bacillus subtilis isolates that improve performance. Very different. Much like a species of animal. We're a single species in this room, and we're all different. So are the Bacillus isolates. I don't think those species matter so much, whether it's a Bacillus coagulans or a Bacillus licheniformis or Bacillus subtilis. They have to be generally recognized as safe, but they need to be organisms that are producing beneficial effects within the animal. And the species is probably, think of what you know about enteric pathogens like Salmonella, for example. We have very virulent strains within each serotype, and we have some strains that are not virulent at all, right, of the same serotype or species. The same is true with the Bacillus, and I think that's a big misconception that, and people who think that way are saying, well, dogs are all the same species, so the little bitty Chihuahua dog is the same as the great big muscular dog, but they're the same species, but very different organisms, right? Did I answer your question? Okay, thank you. Other questions? Yes, sir.
Application in layers. Where would you see the application making these microbes in layers and where?
We have not done much research in our lab with layers. There's an ongoing study at Texas A&M that's sponsored by Pacific Vet Group in layers, and I don't have any of the data yet for that. It is being used widely in the United States right now. The acceptance has been incredible during the last year and a half in layers, but primarily for the purpose of salmonella control and table egg production birds, and that's where the first adoption has been. With the lactic acid bacterial product Floramax, we've had a lot of acceptance with that product in the layer, even though we haven't done any specific research on it. they say they get more eggs. Well, we did a little study where we looked at it, and it appears that we're getting better eggshell thickness and strength. And so they're getting more eggs because they're losing less eggs in that case, probably due to nutrient absorption. Also stained and soiled eggs with the Floramax, the lactic acid bacterial product. And that's a very impressive phenomenon to be able to treat a flock that has a large percentage of stained eggs due to this bacteriosis within the gut affecting the stickiness of the feces on the eggshell. And to be able to see results in 24 hours where you have a marked decline of eggs that have to go to the breaker plant because of fecal staining. So there's applications, but our laboratory is primarily focused on meat production, not on table egg production. Any of the scientists at PBG have anything to add to that?
You did a good job.
Other questions? Comments? Yes, sir.
What do you think happens after an antibiotic treatment? It seems like, at least anecdotally, some of the people that use antibiotics then have salmonella problems that develop after that. What do you think causes that?
Yeah, well, we published 2 papers on that in the mid-90s. It became, when the Salmonella enteritidis problem in the United States became a major issue for food safety, early 90s, a number of table egg production integrators actually decided that they would pulse these guys with antibiotics. And the antibiotic that they were using at that time has been withdrawn from the market, nitrofuran type antibiotic. But they were pulsing these birds with nitrofurans, which was actually labeled for use in laying hens. And we actually looked at that concept. And even when we had nitrofuran sensitive strains, we were able to show that the ability to infect those hens after treatment was markedly increased. And so what you're doing when you pulse with an antibiotic, and it's necessary, it's important to be able to use these drugs. I'm not against using drugs for what they're for, but the problem is there is a negative impact. They are toxins, antibiotics, anti-bio, anti-life. They're selective toxins that are hopefully more pathogenic for the target organism than they are for the host, but they're not vitamins. And you come in and destroy, totally sodomize the intestinal microflora with those therapeutic antibiotics and make these animals exquisitely susceptible for a period of time to enteric challenge. And it's a very real phenomenon published in 2 papers in avian diseases. That's not a theory, that's a fact. Did that answer your question? Yes, ma'am.
Do any trial or data research on this bacteria against the Campylobacter? Because that's leading foodborne diseases, and does it have any effect to reduce the prevalence at the slaughter age?
We have not done much with Campylobacter in our group. There's another scientist at the University of Arkansas, Dr. Dan Donahue, that has shown some fairly significant reductions in Campylobacter. I think Campylobacter with direct VIV microbials is going to be a tough target. And the reason is the Campylobacter actually lives in a mucin niche just associated with the epithelial cells. So it's not really in the lumen, and it's not really attached to the mucosa. It's in the mucin layer, and it's thriving in that mucin layer. So to be able to find effective competitive exclusion cultures for Campylobacter. The other issue with Campylobacter is probably about 85 to 95% of commercial broiler flocks in the United States are infected at processing. And the levels that we find in the gut for Campylobacter are staggering. I mean, we're talking 10 to the 8th, 10 to the 9th, 10 to the 10th colony-forming units per gram of mucosal scraping. There's enormous numbers of Campylobacter. That's right. For poultry meat. That's right. Yeah, it's a worthy target, but we've been, you know, we use the salmonella model not just because we're interested in salmonella, but because it mimics many of the other opportunistic enteric pathogens that are costing us feed efficiency. So one of our major goals is it's not just food safety. We'd like to reduce salmonella, of course, and that's important, especially in table egg production birds. But it's also important for broilers. But and you're right, Campylobacter is another target. But our overwhelming interest is to find replacements for antibiotic growth promoters to be able to show improved feed efficiency. The world population is expanding exponentially, and grain production is going to go up, but not at a fast enough rate. And the meat industry is going to have some very significant challenges coming up, but really great opportunities for poultry at the same time, because of relatively better feed efficiency as compared to swine or beef, right? But feed efficiency is tremendously important to me, and something that I worry a lot about. Even within my lifetime, I think we're going to see a lot of hungry people in the world because there's not enough grain to go around. But I'm sorry, we haven't worked on Campylobacter. That's a good question. Any other questions? Yes, sir.
I'm just curious. Sporting is based on the combination of different spore-forming bacteria, and Floramax is lactic acid bacteria based.
That's right.
My first question is are these two probiotic treatments combined during the feeding of the animals?
They have been, and actually, one of the recent, Dr. Ross Wolfington's in the back, one of the recent performance trials that was done in Korea, actually looked at combinations of the two. And Ross, do you want to speak to that?
You actually showed that data
Right.
at the end there, and we had very, very good success. We actually had both tremendous improvements in feed conversion and average daily gain. More so than, it really appears there's a synergism between the two products, because they do appear to inhibit different niches in the gut, so that they have slightly different effects, and there's an opportunity for synergism when using the two products concurrently.
Okay.
I suspect we've suspected that that's true for a long time, and that's the only data I know of that's actually measured it.
My second question is that since we're actually using spore-forming bacteria in these probiotic feeds, wouldn't that raise the risk of carryover contamination during slaughtering and during cold storage of the meat?
Well, there's tremendous numbers of spoilage organisms that pass through the chill tank of processed poultry, but Bacillus subtilis is not one of those. Okay, they're not psychrophilic. They won't grow at cool temperatures. They're not likely to contribute to sporage, but it is one of the reasons why it's so important to make sure that the isolates are truly safe. They're toxin-free. They don't produce homolysins, and they're generally recognized as safe species, because there will be some carryover, undoubtedly, as there is with pathogens and everything else that come from, everyone in this room is associated with poultry production probably in some way. And it's no surprise that it's impossible to separate the feathers and the gastrointestinal tract of a live animal without any contamination of the edible product, the skin and so forth. I mean, it's just not possible. So there's always going to be carryover. I'd rather have generally recognized as safe organisms as pathogens, and they're not spoilage organisms. On the other hand, one of the things we are looking at is, do these accumulate and do you get magnified effects over time when you're using a product serially flock after flock as spore numbers in the environment continue to accumulate? And that's an exciting question that we don't have data for yet.
Thank you.
Thank you. Any other questions, comments, or snide remarks? Thank you very much.
Thank you, Dr. Hargis, and thank you all for coming. If anyone has any other questions, we'll remain here, and please feel free to come up to us afterwards, and we'd be happy to answer any of your questions. Thank you very much.
Company in VIV Asia, but I think it won't be the last one because I think it is very worthwhile. I am the co-founder of Group OX. Group OX is a business leading group whose main activities are based on research and development, production, implementation, and management of integrated biosafety solutions to meet the demands of different markets, institutional, veterinarian, agriculture, and industrial markets. With our advertisement for 2013, GoWox 100% biodegradable, we know how, we open this meeting today to present the secrets revealed on a 100% biodegradable, non-resistance creating innovative biosafety management strategy. My presentation today will be divided into three main topics. The first one will be basic principles to implement an intelligent biosafety management. Secondly, we will talk about searching the ideal biocides to fit the exigency of biosafety management. And finally, we will present the GoWox 100% biodegradable strategy, OX strategy. To finally conclude with some main tips I want you to remember. So let's go to the first topic of the day. This will be basic principles to implement an intelligent biosafety management strategy. And first, I wanted to give you a definition for biosafety. Biosafety means prevention. Prevention because we have to implement a set of physical and chemical barriers and management guidelines that are established in a facility to be able to prevent the entrance, dissemination, and exit of infectious agents that could affect animal health and quality of food production. So we need to work into the complete chain of production, not only the farm, but also the food processing production. Biosafety management involves a combination of attitudes, routines and guidelines, proceedings, communication, and of course, common sense. In the end, we want to prevent. We do not want to treat, we want to prevent. And that prevention will be controlling different agents, microbial agents causing lethal diseases, microorganisms that could affect the production parameters, also controlling immunosuppressive and predisposing agents, and finally, controlling risk pathogen agents for public health. The three main objectives we have when we are working on biosafety are, of course, to optimize production costs. Secondly, we have to contribute to animal welfare. And finally, we have to guarantee food safety. Why do we do this? I mean, we have three cornerstones in the biosafety management. First one is isolation. We need to isolate the farms to prevent the entrance of diseases. This is the first thing we have to do. But we also have to maximize the resistance of animals. Normally, this resistance, we make it through vaccination. And finally, we also have to minimize the exposure of animals to contamination by good manners of hygiene and disinfection. So these three points will be the cornerstones of our biosafety management strategy. However, we have to adapt all these guidelines to the different farms because we have a specific situation in each farm, so we cannot work with a general proceeding for everybody. We need to adapt. To adapt, we need to make a prior biosafety audit. With a preliminary biosafety audit, we will be able to make a risk assessment, an objective risk assessment. And with that assessment, we will be able to customize the protocol or the proceeding we really need to implement in that particular case. So we need to invest just the necessary resources depending on the risks we assess and on the particular problems we find in those farms we visit prior to implementing any proceeding. We need to go further and we need to implement intelligent biosafety strategy. Intelligent biosafety strategy means that we need to follow some steps. First one will be, as I told you, and just to summarize, it will be to make a technical audit. This technical audit will let us know the critical points we have in that farm or in that particular case. With that technical audit, we are able to make that customized working protocol, that customized working proceeding in order to implement only the necessary resources. In this proceeding, we need to have right products. It's important to select the best products to be able to obtain the results we really need. And we need to monitor, we need to self-control the results we will have with this biosafety program we first developed, we first designed for that particular case. With that self-control, we are able to see if there are any problems with the proceedings we first developed. We need to know if we need to implement corrective measures, if we have to make any changes in order to have better results in that proceeding we've been developing first. So these 5 steps will have to be reviewed carefully before implementing a biosafety program. We need to take care of these 5 steps in order to have good results. Talking about the usage of right products, that leads me to the second topic of this presentation, which will be searching the ideal biocides to fit the exigency of our biosafety strategy, right? And here we have to comply with different features to recognize if the product I have selected is the right one or not. We need to have a wide efficiency spectrum. That is the first point we have to check, wide efficiency spectrum. Then we also need to have fast action, non-resistance creating, high penetration power, effectiveness non-dependent on work conditions. We also need to be non-corrosive, non-toxic subproducts generated by the usage of those biocides. We need to have environmentally friendly biocides, and finally, economically feasible. So these are the main features that the ideal biocide product should comply with, because we really need to be updated with this, and we really need to comply with all this. Let's talk about the spectrum of action, because this is the first thing we really need to take care of. Talking about the spectrum of action, the American FDA divides the efficiency into 3 different stages: low biocidal efficiency, mid-level biocidal effective, and high biocidal efficacy. The low biocidal efficacy regards here we include products that are not active against fungi, Mycobacterium tuberculosis, viruses with protein capsule, and spores. For example, the quaternary ammonium salts could be included into these low-level efficacy biocides. The mid-level biocidal efficacy will be attending to those disinfectants who are not active against spores, for example, iodine, chlorine, ethanol, phenol, and derivatives. Those are not effective against spores. And in the last stage, we have the high biocidal efficiency. In this group of disinfectants, we have those disinfectants who have complete destruction of microorganisms. For example, the hydrogen peroxide and peracetic acid, and the formaldehyde and glutaraldehyde. So this is an objective classification made by the American FDA many years ago to declare what disinfectants are low, mid-level, or high efficient in the farms. If we see this graph, you will see we were comparing 6 different chemical substances: chlorinated, quaternary ammonia, iodophores, aldehydes, combination of quats and aldehydes, and a combination of hydrogen peroxide and peracetic acid. And we are comparing these substances against different microorganisms. Gram-positive bacteria may see, we can state that aldehydes, for example, are low efficient against protozoa and also low efficient against spores. We also have problems with quaternary ammonia because they are not effective against spores and protozoa, and they are low efficient against gram-negative bacteria. Also, chlorinated are not efficient against protozoa and very low efficient against fungi and spores. So if we analyze or interpret this chart, we will see that only combination of quats and aldehydes and combination of hydrogen peroxide and peracetic acids are able to destroy with a high level of efficiency the microorganisms we are really combating in a farm. Also, talking about efficiency, we must say, if we compare hydrogen peroxide and peracetic acid against aldehydes, we will see that they have a different mode of action, which will make us decide which of these substances is better. Hydrogen peroxide and peracetic acid works by oxidation, by chemical oxidation, and this chemical oxidation allows the disinfectant, the peracetic acid, come through the cell wall, destroy the cell wall, and enter into the microorganism to inactivate the enzymatic activity, to alter the ADN, and therefore the complete metabolism of the cell. In this case, there is no possibility of creating any resistance because the hydrogen peroxide destroys the cell wall and the peracetic acid enters into the cell wall, to destroy and alter completely the metabolism. In comparison with the aldehydes, these work electrophically active. In this case, they interact with the cell, but they do not destroy the cell. They also enter to alter the metabolism of the cell, but they do not destroy, they do not make holes in the wall to destroy the cell. In this case, there is a possibility of resistance, of creating resistance to the disinfectant substance because there is not a destruction and oxidation of the microorganism. So from the point of view of efficiency, we could say that the most efficient substances available in the market nowadays are the combinations of hydrogen peroxide and peracetic acid. But as we said before, we do not only have to take care of the efficacy, which is important, but also we need to take into account the physical and chemical parameters that interact with our disinfectant, because it is also important to know which parameters could affect the efficiency of the disinfectant. And in this case, you see that, well, we are comparing the same substances. In this case, we are comparing effectiveness in presence of organic matter, effectiveness in a wide range of temperature, the biodegradable nature of the substances, and finally the corrosion. And as you can see, the only substances that can completely be effective in any hard condition are the hydrogen peroxide and peracetic acids, because they have a high spectrum of action